Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Our guest today is board-certified orthopedic spine surgeon, Dr. Neil Pasia, and he's going to be talking about a very common problem, back pain. Dr. Pasia, welcome back to Today's Health.
Thank you. It's nice to be here.
Well, as a framework for our discussion, let's start with the anatomy of the spine.
Well, sure. Anatomy is a great place to start. As you're aware, the spine is a very complicated structure. Its main job or duty is to house the nerves in your spinal cord, your nerves traveling down there, but it also contributes to structure holding up your spine, holding up your whole entire back, and holding your head on top of your shoulders. Well, that whole process can get pretty complicated. It would be fine if the spine didn't have to move. Then the nerves would just exit. They would be fairly well protected. But we have to bend, we have to twist, we have to extend and flex. And because of that, we need motion. And that motion is what leads, in a lot of ways, to the problems. It's a complicated structure that has to move the way you want it to. Well, the whole spinal cord is housed in the vertebrae in your spinal column. The motion has to happen with the muscles, the tendons. They get pushed and pulled to move these bones and the joints. The nerves, represented by the yellow structure here, and the nerve roots exiting out of the small holes. It's broken down into small segments of motion. The transverse processes, the spinous processes. The spinous processes are the parts of your spine that you can actually feel through your back. Well, all these act as little attachments for the muscles, for the tendons, so that the spine can move back and forth, up and down. Not only that, there's a modified joint of the disc itself, which has to allow motion and also give support to the spinal column too.
Wow, it's amazing that it's as pain-free as it is for as long as it is with all that complexity.
Absolutely.
What are the common causes of back pain?
So the most common causes, with all the complexity like you mentioned, has to do with moving those joints, moving the discs around and still protecting the nerves. Just like we sprain our ankle or hurt our shoulder, all those muscles, all those tendons, all those ligaments can get damaged. They can get sprained, they can get tweaked or torn, and that causes a lot of the back pain that most people experience. And usually, just like spraining your ankle or something like that, it can be very self-limiting. It just gets better with a little bit of time. However, sometimes it can be much more serious. You can have instability between the bones. You can have a disc. Because the disc has motion to it, it has potential of wearing out. Same with all the joints, the facet joints, in between each of the bones. Because they have motion, they can wear out. As they wear out, just like arthritis in a person's knee or their hip or their shoulder, it develops spurs. The capsules around there thicken. That can be quite painful. The cartilage can get worn out, and the disc itself is a modified type of cartilage that can get worn out too.
Well, you talked about nerves, and so one of the most common things I hear people complaining about is sciatica. What is that?
Absolutely. Sciatica is a very predominant form of pain that people get in their low back. The sciatic nerve itself is formed by the lumbar spine nerves. So in your lumbar spine, the nerves all come together, and they form what's called the sciatic nerve. Well, that sciatic nerve, anywhere it can be pinched, you can generate sciatica type pain. That sciatic pain is very typical, and we see it here on our screen again, where the nerves from the lumbar spine form and they join together in the sciatic nerve, and they pass out down the back and sides of your legs. As it passes down, it goes over a very common distribution. It can be a type of burning type of pain, or a numbness, or a tingling. All those types of pain symptoms manifest as sciatica type pain.
Who's at risk for it, and can you prevent it?
Well, you can try to prevent it. It's very common that people over the course of their lifetime get some sort of back pain, including some sort of sciatica. The people most at risk, well, as your spine starts to wear out, being an older individual, because of the wear and tear of the joints and of the discs start to bulge. They start to narrow the space for the nerves. The joints, as they start to degenerate, they develop these spurs, and that narrows the space for the nerves as well. Anywhere, and that can pinch the nerves and cause that sciatica. So older individuals can be at risk. People who are younger can be at risk too, because the disc itself sometimes can tear or herniate, and a person can have a herniated disc, which will also press on the sciatic nerve. To prevent it, well, you're trying to protect those structures. You're trying to give support. The best way to give support to those motion segments is to keep those muscles fit, keep them strong, keep them loose.
Well, we're going to switch a little bit here to a real mouthful, and I hope I say it correctly, spondylolisthesis. What is that?
Exactly, spondylolisthesis. So when talking about those motion segments, the segments themselves generally they're supposed to bend, they're supposed to twist, and to a pretty decent degree. And most of the time that happens normally. Sometimes the bones themselves will slide one on top of the other. And when they slide abnormally, it's considered a spondylolisthesis. Spondylo meaning spine, listhesis meaning a slip. And so it's sliding one on top of the other. That in and itself can cause pain, and it can cause pinching of the nerves too. When that happens, it can be a much more significant issue for a person because that slip becomes a bit of a weak link in their spine. And so as things continue to wear out, it manifests more significantly at that weak link.
Lots more to talk about, but we're going to take a break.
Great.